89% of seniors ignore heart failure signs, raising sudden death risk 12% per day. Learn 13 warnings to act early and save lives. Please take note, at this very moment 89% of Americans over the age of 60 are disregarding these warning signs, and this could end up costing them their lives. It is likely that you are ignoring the signs of aging or stress as the cause of the symptoms you are experiencing. But your heart is making a desperate attempt to communicate something to you. Your chances of experiencing sudden cardiac death grow by 12% for each day you choose to disregard these warning signs. I will reveal 13 warning signs that could save your life tonight, but you must remain with me for the next 15 minutes. Before we get started, however, I would like to ask you to click the subscribe button and enable notifications if you are concerned about your health. This is because it is here that we reveal the truths that no one else discusses. I would also like to know if you are with me. If you are watching now, if this video resonates with you, please type 1 in the comments section. If not, please type 0. You are unaware of how important your voice is. As somebody who works in healthcare, I was taken aback by the following. Currently, there are more than 6 million people in the United States who suffer from heart failure, and the majority of them are unaware that their bodies have been trying to send them warning signals for months. Please click subscribe and tap the bell now. If even one line here saves a life, it was worth your click. Sign number 1, exertional shortness of breath. There's a quiet, creeping fear when something as simple as walking to the mailbox or climbing a single flight of stairs suddenly leaves you breathless. That heavy gasp for air after the smallest effort isn't just age or being out of shape, it's your heart pleading for help. This isn't the breathlessness that comes from a good workout, it's a new and constant struggle, a sense that your body just can't get enough oxygen no matter how slowly you move. You may notice yourself pausing more often, using elevators instead of stairs, or needing longer breaks to recover after the tasks you once did easily. Sometimes, it's so subtle you don't even realize how much you've slowed down until someone points it out. But behind that breathlessness, your heart may be struggling to pump enough blood to your muscles and lungs. It's your body's way of telling you something isn't right. Ignoring it means allowing the problem to quietly worsen day by day, but noticing it early, and getting checked, can change everything. So please, don't brush it off as normal aging. Your heart is asking for care, and listening to it could be the first step towards saving your life. Sign number 2, orthopnea, needing extra pillows. Needing an extra pillow, then 2, and eventually choosing to sleep in a recliner just to breathe comfortably, is more than a simple comfort issue. It's your body quietly showing that gravity is revealing something deeper. Fluid is slowly backing up into your lungs. When lying flat makes breathing difficult, and you find yourself propping up your head higher and higher each night just to get some rest, it means your heart is struggling to keep that fluid where it belongs. Many people ignore this at first, thinking it's just sinus problems, indigestion, or aging. But that growing need for elevation is your heart whispering for help before it starts to shout. You may notice waking up coughing, gasping, or needing to sit up in the middle of the night to catch your breath. These are not normal parts of aging, they are signs that your heart can no longer handle the pressure changes that come when you lie down. It's subtle, it creeps in quietly, and often you only realize it after weeks of restless nights. But catching it early and speaking with your doctor could stop those long, breathless nights from turning into a medical emergency. Sign number 3, paroxysmal nocturnal dyspnea, waking gasping. Waking up in the middle of the night gasping for air, as if you're drowning, is one of the most frightening experiences a person can have. It often happens 2 to 4 hours after falling asleep, and for a few moments, it feels like you can't get enough oxygen no matter how hard you try. Many people mistake this for a panic attack or a bad dream, but in reality, it's your heart crying out for help. This terrifying sensation occurs when fluid, which has been collecting in your body during the day, shifts into your lungs as you lie flat, overwhelming a heart that's already struggling to pump effectively. You may wake up coughing, sweating, or sitting upright just to breathe again. It's a desperate attempt by your body to relieve the pressure and get oxygen flowing back to your brain and lungs. If this happens more than once, it's not something to ignore or dismiss as stress or anxiety, it's a serious red flag. These episodes are your body's way of screaming for attention in the silence of the night, warning you that your heart needs care before things take a dangerous turn. Sign number 4, extreme fatigue. When something as simple as taking a shower leaves you completely drained for hours, or when the hobbies you once loved start feeling like heavy chores, that deep, lingering exhaustion is not just a normal part of getting older. It's a warning sign that your heart may be working harder than it should. When the heart struggles to pump enough blood, it begins prioritizing vital organs like the brain and kidneys, redirecting energy away from your muscles and tissues. This leaves you feeling weak, tired, and unable to recover even after rest. You might notice yourself napping more often, skipping walks, or losing motivation for daily activities that once brought you joy. It's a quiet, creeping kind of fatigue that doesn't go away, no matter how much you sleep or how well you eat. Many people dismiss it as age or stress, but this kind of bone-deep tiredness can appear months before any other heart-related symptoms. Listening to your body at this stage can make all the difference. Don't ignore it or push through. This could be your heart's first whisper asking for help before it starts to shout. Catching it early could save not only your energy, but your life. Sign number 5, edema, swelling in legs and ankles. Swollen ankles that leave deep sock marks or shoes that suddenly feel too tight are not just small annoyances, they can be your body's quiet cry for help. That soft, puffy swelling, known as edema, happens when your circulation can no longer move fluid efficiently. Over time, fluid begins to collect in the lower parts of your body, especially in your feet, ankles, and legs, because gravity pulls it there. When this swelling comes from heart issues, it's usually seen on both sides and tends to worsen as the day goes on. Many people think it's caused by eating too much salt, standing too long, or simply getting older, but it can be much more serious. Your heart may be struggling to pump blood effectively, causing pressure to build up in your veins and forcing fluid out into your tissues. You might notice that pressing your finger into your leg leaves a dent that takes a few seconds to fade. That's called pitting edema, and it's a clear warning sign. This visible swelling isn't just cosmetic, it's your heart's way of showing distress. Ignoring it allows the problem to quietly worsen, but paying attention and seeking help early could prevent serious complications later. Sign number 6, rapid weight gain from fluid. Gaining 2 to 3 pounds in a single day or 5 pounds within a week might seem harmless, but it's not normal. It's your body silently holding onto fluid because your heart and kidneys are no longer working in perfect balance. When the heart weakens, it can't pump blood efficiently, and that extra pressure causes fluid to build up in your tissues instead of being filtered out by the kidneys. What you see on the scale isn't fat, it's water your body is struggling to remove. Each extra kilogram on your body can mean nearly a liter of trapped fluid inside you. You may notice your rings feeling tight, your clothes fitting differently, or your stomach and ankles looking puffier than usual. These subtle changes often appear before any pain or shortness of breath, making daily weighing one of the simplest and most powerful habits for early detection. If you see your weight jump suddenly, don't ignore it or assume it's just from food. It could be your heart's first warning sign that it's overwhelmed. That small number on the scale could be your body's way of saying, "I'm drowning inside." Acting quickly by contacting your doctor could prevent a hospital visit or even save your life. Sign number 7, nocturia, needing to urinate at night. Waking up 3 to 5 times a night to urinate, and noticing that the amounts are larger than usual, might seem like one of those small inconveniences of getting older, but it's often something much more meaningful. What's really happening is that your heart is struggling to circulate fluid properly during the day. When you lie down at night, gravity shifts that trapped fluid from your legs and lower body back into your bloodstream, sending your kidneys into overdrive and forcing you to make repeated trips to the bathroom. Many people blame this on drinking too much water before bed or age-related bladder changes, but in reality, it can be one of the earliest signs that your heart is having trouble managing fluid. Nocturia, frequent nighttime urination, can appear months before any obvious swelling or shortness of breath begin. It's your body's subtle way of saying that something isn't right with your circulation. If your nights are constantly interrupted by this pattern, it's important not to ignore it. This nightly cycle isn't just about sleep loss, it's a sign your heart is asking for help before the problem grows bigger. Listening to these early whispers could prevent a future emergency. Sign number 8, nighttime cough or frothy mucus. A persistent dry cough that becomes worse when you lie down, and sometimes brings up frothy or pink-tinged mucus, is not always a sign of allergies or a lingering cold. Often, it's your body quietly revealing that fluid is starting to creep into your lungs because your heart is struggling to pump blood efficiently. When the heart weakens, pressure builds up in the blood vessels of the lungs, allowing fluid to leak into lung tissue. Your lungs, in turn, try to protect you by triggering a cough to clear the fluid, especially when you're lying flat at night. Many people try cough syrups, inhalers, or humidifiers, hoping it's something simple, but the relief is usually temporary, because the true cause isn't in the throat, it's in the heart. If you notice that your cough improves when you sit upright but returns every night when you lie down, that's a clear warning sign that shouldn't be ignored. It's your body's way of saying, "I'm struggling to breathe." Recognizing this pattern early and seeking medical help could stop the problem from progressing and give your heart the support it needs before things become far more serious. Sign number 9, palpitations, fluttering or skipped beats. Feeling your heart suddenly flip, flutter, or race while you're resting can be frightening, and it's a warning sign that should never be ignored. These sensations, known as palpitations, can feel like your heart is skipping a beat, pounding too fast, or fluttering inside your chest for no clear reason. While occasional palpitations can happen from stress, caffeine, or dehydration, when they occur frequently or come along with other symptoms like shortness of breath, fatigue, or dizziness, they may signal that your heart is struggling to maintain a steady rhythm. This happens when the electrical system of the heart becomes unstable, a problem that often appears when the heart muscle is weakened. Over time, irregular rhythms, called arrhythmias, can make the heart even weaker, creating a dangerous cycle. Heart failure can cause irregular beats, and those irregular beats can make heart failure worse. If you notice your heart racing for no reason, or that uneasy thumping feeling in your chest, don't dismiss it or hope it goes away. Your heart is trying to get your attention. Getting a proper cardiology evaluation can reveal what's happening early, and may prevent a small rhythm issue from turning into something far more serious. Sign number 10, dizziness or near fainting. Feeling lightheaded, dizzy, or as though you might faint when you stand up is not just a simple balance issue, it can be your body's quiet cry for help. These dizzy spells often happen because your heart is struggling to pump enough blood to your brain. When the heart weakens or beats irregularly, it can't maintain steady circulation, especially during position changes or physical activity. You might notice your vision dimming for a moment, a rush of warmth, or a sudden need to grab onto something for support. Some people describe it as the world spinning or a feeling of floating away. While these moments might pass quickly, they should never be brushed off as harmless or blamed solely on dehydration or age. If standing up, walking, or even bending over makes you feel like you could pass out, it's a signal that your brain isn't getting the blood and oxygen it needs. When this happens along with other symptoms like fatigue, palpitations, or shortness of breath, it becomes an even clearer warning that your heart is losing its strength. Taking these episodes seriously and seeking medical advice early can prevent a dangerous fall or even a life-threatening heart event. Sign number 11, digestive symptoms, nausea, fullness, bloating. Feeling uncomfortably full after eating only a small portion, dealing with persistent nausea, or noticing a constant bloated, heavy feeling in your upper stomach might seem like ordinary digestive problems, but they can actually be signs of something much deeper. When the heart begins to weaken and can't pump blood effectively, it affects the entire body, including your digestive system. Reduced blood flow to the stomach and intestines can slow down digestion, making you feel full too quickly or uneasy after meals. At the same time, fluid can start to build up around the liver and abdomen, creating pressure and bloating that won't go away. Many people blame these symptoms on indigestion, stress, or aging, not realizing that their heart may be the real cause. You might lose your appetite, skip meals, or start eating less simply because your body feels too uncomfortable to handle food. But when your heart struggles, every organ feels the impact, and the digestive system is often one of the first to show it. So if eating has become uncomfortable or your belly always feels tight and bloated, don't ignore it. These stomach troubles could be your body's gentle warning that your heart needs attention before the situation worsens. Sign number 12, bendopnea, shortness of breath when bending over. If you notice that bending over to tie your shoes, pick something up, or reach into a cabinet suddenly leaves you short of breath within just 30 seconds, that's not normal, it's a strong warning sign known as bendopnea. This very specific type of breathlessness happens because bending forward increases the pressure inside your chest, making it harder for your heart to pump blood effectively. When your heart is already struggling, that small change in position can quickly make you feel breathless or tight in the chest. Many people mistake this for being out of shape or simply getting older, but bendopnea is a well-documented and very specific sign of elevated heart pressure. You might find yourself sitting back upright to catch your breath, taking a few moments before continuing, or avoiding bending altogether without realizing why. It may seem like a small inconvenience, but it's your body's way of saying that your heart is under strain and needs attention. Ignoring it allows the underlying issue to quietly worsen over time. If this breathlessness keeps happening whenever you bend forward, don't dismiss it, it's one of the heart's clearest signals that something isn't right and should never be ignored. Sign number 13, cold extremities and narrow pulse pressure. When your hands and feet remain cold even in warm weather, or when your lips and nails start to take on a bluish tint, it's often more than just poor circulation from sitting too long, it's your body prioritizing blood flow to vital organs like the brain and heart. This happens when the heart's pumping power weakens, and the body redirects limited blood away from the extremities to keep the core organs alive. A related clue is a narrow pulse pressure, which means the difference between your top, systolic, and bottom, diastolic, blood pressure numbers is smaller than normal. This often indicates that your heart is ejecting less blood with each beat, a subtle but serious sign of reduced strength. You might notice your fingers feeling icy or your toes looking pale no matter how warm the room is. While these symptoms seem mild, they are your body's quiet cry for help. Cold extremities and bluish skin are not just cosmetic concerns, they are signs of poor circulation and a struggling heart. Paying attention to these early warnings can make all the difference before the situation becomes critical. If any of these signs sounded familiar, please act, don't let gradual changes become emergencies. Track your symptoms, weigh yourself every morning, note swelling, and share these observations with your doctor. Early diagnosis and treatment can prevent up to 90% of severe heart failure crises and dramatically improve quality of life. If you noticed more than one sign together, seek medical attention promptly. If this video helped you or touched someone you love, please like, share, and subscribe to Timeless Wisdom Path for more clear, life-saving health guidance for seniors. Tell us in the comments which sign surprised you most, type 1 if this resonated, or 0 if it didn't, and please share Margaret's story with friends or family who might be ignoring similar signals. Remember, your heart has been working for you without asking anything back. When it starts to send warning signals, listening could save a life.